more on this, I want to bring in Dr. Anand Swaminathan for a few questions, and also to Ed O'Keefe, our senior White House and political correspondent. Dr. Swaminathan is an emergency medicine physician at St. Joseph's University Medical Center in New Jersey. And as I mentioned, Ed is a senior White House and political correspondent. Ed, let's begin with you. We're seeing a spike in breakthrough cases among vaccinated Americans. How are we as a country better prepared than we were a year ago?
Well, as the president said, this isn't March 2020 because more than 200 million Americans are now vaccinated. People are starting to get their boosters, although only 30% of those eligible have done so far. And so he, at least 3 or 4 times in these remarks, said, if you can, go out and get your shot, get your booster, protect yourself, protect your young children who may not be eligible yet for shots, and feel free to go about your holiday plans if you are one of those that has taken these steps. But if you're not, you could face hospitalization and potentially death. Stepping up his remarks, being a little more straight with Americans about the consequences of not taking advantage of free vaccinations, and then saying that the testing program is going to get revamped and sort of scaled up in the next few weeks. We're still waiting for details on how this will work, but 500 million tests will be distributed for free across the country. Americans will be eligible to go online and order them to come to their home. Still not clear what that website is, how reliable it will be, and how quickly the tests will get to Americans, whether they get to Americans in time to catch a test or to catch a positive case at a time when the infection rate is climbing. But all of this a sign of how they're trying to scale up here at the White House in preparation for what is expected to be a pretty large surge, not only in the Northeast, but in other parts of the country.
And Ed, most of what the president is addressing is the increased testing efforts as well as the federal deployment of other medical resources. Any word on future lockdowns?
No. They made very clear ahead of his remarks, and he said it to some extent here today, there is no plan to implement national lockdowns or new federal mandates on that, believing at this point, both from a realistic, logistical, and political standpoint, that those kinds of decisions have to be made by mayors, county executives, and governors who are better equipped to understand what's going on in their communities. You've also seen it among private businesses, whether it's Broadway having to cancel or shut down productions and live shows, whether it's other cities planning to cancel or scale back or make virtue of their New Year's Eve plans. Those are the kinds of decisions the White House believes have to be made at a local level. There will be no new federal lockdown or mandate of that sort, at least for now.
Right. Now, Dr. Swaminathan, the Biden administration will begin distributing, as Ed said, 500 million free at-home COVID tests to Americans in the coming days. How exactly do you hope that this plan will work out?
Well, getting a rapid test to people is the right thing to do, but it might be a little bit too late, or at least it's later than it should have been. We should have been talking about getting 500 million tests out months ago, and we should be ramping up to the point that everybody has access to those rapid tests when they need them. We look at other countries like United Kingdom, where you can pick up a 5 or 7 pack of tests every day to test your family. And that's really what we need. 500 million sounds like a lot, but 330 million people, it's really not enough when you think about the fact that these tests are best when used serially, to test every day that you could possibly have an infection or that you're going to gather. So for instance, I'm going to get together with about 14 people total, my family, my parents, a little bit of extended family for Christmas. We're all going to test before we gather, despite the fact that everybody has been vaccinated. Now, if we're going to meet the next day, ideally we would test again the next day. So that's already 2 tests for each person. We're not giving enough by saying 500 million. Those tests aren't going to come for a couple of weeks on top of that. And only having it set up through an online portal, we should be learning from the mistakes that we made during vaccinations. I saw many patients who wanted to get a vaccine but didn't have internet access. They couldn't make that appointment. So we should have these tests in the post office, in grocery stores, in bodegas, anywhere that you are wandering by. You should be able to pick up those tests to take home, keep yourself and your family safe. So it's not quite enough. It's a first step, but we clearly need more in terms of testing.
I mean, and the cost part is important. I've bought these tests, and they're expensive. You find them at the pharmacy if you're lucky. Sometimes you have to go several places to come across them. But what about the accuracy? I mean, you mentioned the importance of doing it serially, of doing it day by day. Are we concerned, or should we be concerned that these tests that the Biden administration is going to send to people and make available for Americans are actually accurate, especially to detect the Omicron variant?
Well, I think we have to understand that the enemy of perfect is always, or the enemy of good is perfect. And yes, the tests are not perfect, but when used properly, they can add a layer of protection. And it's all about layers. So we should still be doing all the other things: vaccinations, boosting, ventilation where we can, open the windows, do outdoor gatherings, masking when you're in indoor situations. And testing is just adding another layer. But yes, they should be in serial. So if you have a test, we know if you take a test at 6 a.m. today, you could be positive, you could be negative now, but be positive when you take a test tomorrow. So we have to have the ability to serially test, and that's where these things are really robust. If you have an exposure to somebody who has COVID and you take a test and it's negative, it's very likely that even if you have an asymptomatic case, you're not spreading. But ideally, you'd be able to take another test the next day to check and make sure that you haven't converted. So that's really where these tests gain their strength. Single test at a single point in time gives you very limited information. We need to continue to be able to test.
That's an important thing to understand, not to mention the complications that come from a false positive, but that's something to deal with later on. Ed, how is the Biden administration expecting to pay for this?
Well, they're paying for it. Americans won't be paying a cent, according to the White House, and it won't touch your insurance either. This is something that is being paid for essentially with all the money that has been provided by Congress to deal with the pandemic, and they say that there will be no cost passed on to Americans for these tests. That's an important aspect of this. And of course, same goes for vaccines, that all of this being paid for with government funding. We asked earlier today if there's any talk yet between the White House and Congress about the need for more federal funding, even though right now is a great time to be a mayor or a governor because you're flush with new cash from the federal government to deal with the economic and logistical and public health fallouts of this, and you have great disposal with which to spend that money. For now, the White House says they don't see a need for it, that there is plenty of funding, but that is something that certainly lawmakers would consider if this thing really does take off, as some fear, and it puts a bigger strain on public health, on public safety agencies across the country, and if there's a bigger need to get tests or other equipment out. But by pointing out that the stockpile has been replenished and that it's ready to go, that's a sign, too, of how the money that's been provided for this year in the American Rescue Plan that was passed earlier in the year and through other legislation is being spent and being used to mitigate against the potential for greater disaster.
And Ed, was there an answer as to when the test will be available?
So far, they say just in January. Whether that's early January, whether it's late January, we don't yet know. We don't know how many one can apply for when they go online. We don't know the website address. There were questions about whether a federal website is ready to take the massive incoming that it may get, especially in those first few days. Remember, years ago during the Obama administration, there were issues with healthcare.gov right after the Affordable Care Act launched. Questions about whether the federal government was properly capable of running such web services. They insist they're working on that. I asked also, who's going to be delivering these to American doorsteps? Is it Amazon or UPS or FedEx? Is it the Postal Service? And how quickly will it get there? They say, we don't know yet. We will get you those answers, and we'll wait and see what the answers are.
Now, Dr. Swaminathan, Omicron cases are surging nationwide. What's the president's plan doing to address the possibility of a post-holiday spike of infected patients arriving at hospitals and medical facilities across the country, knowing that as much as you test, there will still be a spread?
I think if you ask anybody working in a hospital right now, pretty much anywhere in the country, they will tell you that we are stretched extremely thin. Even places where Omicron hasn't started to surge yet, we are already at our tipping point, at our breaking point, because of all of the losses of healthcare workers we've seen over the last 2 years. We've lost almost 20% of healthcare workers. And so we are stretched extremely thin, and meeting that with another surge is really going to send hospitals to that breaking point. One of the messages that we heard that I don't completely agree with is that if you're vaccinated and boosted, you can go about your travel businesses and get together with family. We are still going to be passing it on. We are going to see breakthrough cases, especially if people who are vaccinated think that they are completely safe to gather in indoor settings, unless they are also testing. It's not enough protection there. And as we see those cases surge, there will be more people who need the hospital. And that's a problem because we're seeing many hospitals with enormously long wait times to be seen by a doctor, enormously long wait times to find a bed. Now, it's good that we are starting to talk about surging some resources. And by resources, I'm not talking about physical beds. We have plenty of physical beds. The problem is that we don't have people to staff those beds. We need nurses, we need doctors, and it goes without saying once again that we need nurses in order to make this happen. Nurses are the critical component to having the hospital run. And so one of the things that we didn't hear here that we really do need is we need to have some tools, some systems to predict when hospitals in the area are going to tip and they're going to break. We know that as cases spike, we can predict when hospitalizations are going to spike in response to that. And so we need to use that data to really help to think when should restrictions come back into place to stop the spread, to stop that transmission in order to create a situation where the hospitals don't tip to that breaking point. Fortunately, we have colleagues, people like Jeremy Faust, who are working on this, who are trying to create those tools so that we can really give areas and regions the information they need to know when those restrictions are necessary. It's great to say local governors and local mayors can make those decisions, but they can't make those decisions without the right data and without the right tools. That's what we really need to be pushing for. So we need more resources to hospitals. We need more of these tools to predict when areas are going to hit that tipping point. And yes, we might have to see some targeted restrictions in order to stop spread and in order to stop those hospitals from breaking.
When you talk about the shortages in, say, nursing staff and otherwise, are we talking about shortages due to burnout? How do you explain that?
These are mostly shortages due to burnout. Yes, there are also healthcare workers who have died during the pandemic, and that hurts. But so many of my colleagues in nursing and physicians as well have left the field. They really have had enough of everything they've gone through. It was too much to take over 2 years. And so we're seeing those huge losses. You'll see stories about how the losses are because of vaccination mandates, and those are simply untrue. We know that. We know the numbers there. These losses have been going on since the start of the pandemic, and they're getting worse because more and more people are starting to burn out. And unfortunately, as people leave, it puts more stress on those who stay behind, which means that more of them are going to burn out. This is a vicious cycle that we really have to be thinking, how do we stop? How do we break? Getting 1,000 physicians and nurses out to hospitals is a good start. Not nearly enough, though.
You know, we've been hearing those stories of burnout, of the mental health effects of the pandemic on so many healthcare workers, medical workers, and it is a serious issue. And it looks like as long as this virus is not in check, neither will that issue. Now, Dr. Swaminathan, can you tell me if you believe that the Biden administration is doing enough to curb the spread of Omicron? You mentioned the messaging of enjoying the holidays, but traveling and the concerns that exist over the vaccines that are abroad may not be as effective as the ones that we have here in America. Do you think they're doing enough?
I think there's more we can do. I think there's clearly more that can be done. In terms of reaching those who are unvaccinated, we know that mandates will help to convince people, so we need to institute more mandates. We have international travel mandates. We need domestic mandates for vaccinations. That's one step that we can take. We need to also really think about global vaccination equity and ramping up the production of vaccines in other countries, not just shipping our vaccines to other places, but helping other countries set up their own vaccine production. That's what really is needed. And we're going to continue to see variant after variant emerge unless we ramp up vaccination appropriately. We've had billions of doses administered, and yet we still have numerous countries who are so low vaccinated that it is just a breeding ground for new variants to emerge. And so unless we are ready to do that work, we're not really going to be able to get out of this. So I think there's a lot more work that we can do. There's a lot more pushes we need to make. I'm happy that we're taking some first steps, but we need a lot more.
It's so hard to think about that, but it's impossible to ignore if we want to move forward. Thank you so much, Dr. Anand Swaminathan and Ed O'Keefe.